As a healthcare provider, it takes courage and commitment to measure performance and face the data. But the commitment to quality improves the odds for each patient entering the intricate maze of our healthcare system. Even when the variables seem infinite, we can build healthier lives. Get with the Guidelines Outpatient provides the data you need to deliver the highest quality care to each patient according to the latest evidence-based guidelines. Together, we can improve performance and raise the odds for healthier lives for each and every patient we treat. You are invited to join with us and generate positive change for better patient outcomes and increased quality of life. Yes, the quality chasm is real.
You know, the 15-minute visit is a very difficult thing. In that 15 minutes, you need to greet the patient, check how their family's doing, find out why they're there today, make a diagnosis, examine them, communicate your conclusion, your diagnostic plan, your therapeutic intervention, provide the prescriptions, and do the documentation in 15 minutes. So think about how many things you forget in that process.
So how will you navigate the chasm?
So the practice of medicine in today's world is not easy. There's so many influences that have to be respected, whether it's an economic influence, whether it's a regulatory influence, a scientific influence, or just variations in practice styles or patient preferences. Nevertheless, we have an obligation to give our patients the best possible care. The way we measure that is by measuring quality, and all of us deal with a quality chasm. That means there is a gulf between where we are and where we need to be. If you're standing at the edge and looking out, it's hard to understand how do you cross that gulf, how do you navigate the chasm.
Use effective tools.
Well, you know, my practice, Midwest Heart Specialist here in Chicago, was in need of a new computer system. Ours had a do not resuscitate sign on it and was in trouble, and we needed a clinical product. We needed something that could help us better manage our patients.
Adopt an attitude of openness.
When you asked the docs, though, before we started, they would have said, we're very good at this. You're not going to need this computer system because we're already doing very well. Well, then we measured, and we found out we weren't as good as we thought. And when we graded them the first time, we found out that many of them were in the 70s. Well, they rejected that immediately and said, no, it can't be right. And we said, no, here's the data. You're a 70. And so that motivated them all to change because they wanted to be the best they can be. None of them get up every day thinking, I'm a C.
Ask yourself the right questions.
The first time that I saw my report card, it wasn't an opportunity to pat myself on the back, but it was an opportunity of sitting down and saying, well, how can I do a better job?
And it allows you, together with your nurse and technical team, to figure out what do I need to do a better job? Where are we missing it? Why aren't we documenting it properly? What patients aren't we treating to goal? What do we need to do to change?
Set goals based on measurable data.
We all believe that we are inherently at least adequate, if not good. It's part of our training, it's part of our indoctrination, it's part of our culture. But unless we know, unless we have data, then we can't be exactly certain. And it's only data that informs us to how well we're doing or how well we are not doing. And so when you start talking about implementing systems of change, you have to know what it is you're trying to change. You need a target. You can only manage what you measure.
We'll have huge databases where we can begin to do research on the outpatient side. Answer the longitudinal questions which haven't been answered, which is how well are they doing 5 years later? Someone whose cholesterol's controlled, whose blood pressure's controlled, did we prevent their second heart attack? So this will be the first time to collate data from practices all over the United States, from three-man practices, from large groups, from academic medical centers, from integrated health systems. All of them will bring their data into a central data repository, and we'll begin to study and show how we can improve outcomes long-term based on better compliance with guidelines. Besides measuring risk factors and controlling them, what we really want to do is build healthier lives so that each American can be in a better place in 2020 than they are today.
Recognize the impact of positive change.
Yeah, I think it's excitingly positive that, we're able to take a practice of medicine where we thought we were doing a good job, put a computer in place and do a much better job, and then have that satisfaction that, wow, we've actually improved the way we deliver healthcare by using a tool, by changing our process, by finding an easier way to take the guidelines that drive how we practice medicine and implement them every day and make us that much more effective at saving lives.
Without question, being involved in Get With the Guidelines has been one of the most enriching and rewarding things I've ever done as a clinician, an investigator, an administrator, as a volunteer. It's been an extraordinary experience. I'm humbled by what I've seen within Get With the Guidelines. The ability to help large numbers of patients do better, the ability to inform a process, to educate the medical community, the return on generating new observations that are then taken up by others and become a charge to make change happen. It's all good. It's all good. And when you're affecting positive change, there are very few experiences that are as rewarding as that.
What if you could raise the odds for every patient you treat by examining your data? Get with the Guidelines Outpatient. Join today.